Okay, hello everyone. Thank you so much for the introduction. Thank you so much for inviting me to talk a little bit more with you about what Genentech is doing in health equity and advancing inclusive research. So today I'm primarily going to focus on the social drivers of health, the collection of social drivers of health data in clinical trials, and then also initiatives to address barriers to research. So my name is Audrey Funwie. I'm a part of the Patient Inclusion and Health Equity team of Genentech's Chief Diversity Office. Prior to this, I graduated from Johns Hopkins University with my Master's of Bioethics. And today I'll be talking to you all about the importance of collecting and understanding the social determinants of health in clinical research studies and providing you with some of the initiatives Genentech has created to advance inclusive research by addressing barriers to research. So the social drivers of health have emerged as leading considerations for patient outcomes. However, the concept has been around for a long time. A cross-sectional analysis of nearly every county in the United States found out that medical care is estimated to account for only 10 to 20% of health outcomes, while 80 to 90% of health outcomes are due to social factors. Approximately 40% was attributed to the socioeconomic factors, 30% was attributed to health behaviors, and 10% was attributed to patient's physical environment. So the examples of social determinants of health are things such as affordability, education, social and community context, health and healthcare, and then also neighborhood and built environment. No one can aim to address all factors that feed into the social determinants, the social drivers of health. However, together we can identify areas of appropriate engagement to help improve health access and outcomes across socioeconomic groups. So first, I wanted to give you two examples of how social factors can affect treatment initiation and completion in cancer clinical research studies. One example is healthcare-related access that might impact cancer care. So one of the factors is maybe long distance travel. If someone is living more than 60, 70, 80 miles from the closest medical oncologist, that can really create a huge barrier to their treatment. So about 20% of rural residents live greater than 60 miles from a medical oncologist. And also when it comes to treatment adherence and persistence, uninsured and underinsured patients generally have a high rate of unadherence and high rates of discontinuation. Is also seen with people who are currently utilizing Medicaid, and also those who self-pay versus those who have private insurance. So there's a lot of factors that go into health-related access, such as the inability to take time off work and the inability to get child or adult care. And we also see this when we look at clinical research studies. Another example is the level of education and health literacy and how that might affect treatment. So language skills and the ability to communicate is a huge factor of whether or not someone will join a clinical research study or take part in the curative treatment for them. The level and quality of education that they have, and then also the lack of awareness of the seriousness of the disease and the associated treatment. So about 18% of breast cancer patients with high school education or less receive non-adjuvant chemotherapy versus 33% of patients with at least some college education. And according to meta-analysis, adherence is about 14% higher in patients with high levels of health literacy than in those with low levels of health literacy. So you're probably all experts in this and you're wondering, why am I telling you this? Like, this is something that we know. But why is it important to address social drivers of health, specifically in clinical research studies? And when I'm saying addressing and collecting, I mean self-reported. So you are asking people to provide you with this information, but it's not something that is mandatory as a part of their clinical research study. But why is it important to address these social drivers? One, it drives innovation. So innovative strategies are needed to identify and intervene for patients who are at risk of poorer outcomes. Collecting factors that impact the patient experience can help with healthcare utilization, transportation, and social support that they might need when they're trying to be a part of a clinical research study, and also when they are trying to just go to the hospital or get regular preventative care. So it's also important for us to understand why patients might be reluctant to join a clinical research study. So social determinants of health, such as proximity to the trial site, insurance status, and income, might deter patients from clinical research studies. So it's collection spotlights where community resources are needed and where services are to close care gaps, and then also for patient safety. This data also helps us identify any differences in the safety profile of our patients in these populations. But now let me talk to you a little bit about what Genentech is doing and the initiatives that we have in order to address barriers to research. I will also spotlight some of the resources that you yourself can utilize if you are taking part in any kind of research, specifically in a clinical research study. So at Genentech embraces the increasingly diverse world around us. Our mission is to be the industry leader to deliver scientific innovations to drive better outcomes for people, patients, business, and communities. So in doing so, we have 3 pillars: fostering belonging, advance inclusive research and health equity, and transforming society. With fostering belonging, we want to attract, retain, develop, and advance our people to their full potential. We reward diverse and bold ways of thinking and integrate inclusive behaviors into every aspect of our work. With advancing inclusive research and health equity, we want to embed inclusion in underrepresented groups in research, develop care delivery to enrich scientific insights, and then also advance health equity and improve access for all. And lastly, with Transform Society, we want to invest and cultivate partnerships that advance diversity and inclusion across healthcare, education, and all communities. Today, I'll be focusing primarily on advanced inclusive research and health equity. So clinical research is not benefiting all groups equally. 95% of our genomic material available is of European ancestry. Black and Hispanic populations are underrepresented in clinical research. Only 1% of Hispanic and Latinx patients are part of clinical research studies, and only 5% of Black and African Americans are part of clinical research studies. But these patients do want to participate. 83% of Black breast cancer patients would consider participating in a clinical research study. And there needs to be more diversity when it comes to HCPs. 5% of physicians are Black, and the disparity is even greater when it comes to non-white Hispanics. And a lot of research has come out to say that the diversity of patients enrolled in clinical research studies is highly correlated with the site personnel diversity. And this can also be seen when it comes to primary care doctors. With more diverse primary care doctors, people who are underrepresented are more likely to get better health outcomes. So there's 83% of Black patients who would love to take Black breast cancer patients who would love to take part in clinical trials, but they're not being asked. So why we are trying to find ways in order to make sure we're utilizing and reaching out to HCPs, but then also changing our internal methods to make sure that we're properly recruiting diverse patients as a part of our clinical trials. Knowing that this disparity exists, we wanted to find ways to address them. So we've assembled an external council of leading experts in the field who are collaborating with us to find solutions that will help tackle systemic barriers and increase health equity and access to investigational medicines. The significant result of this was them telling us that we need to be in the community, that we need to collaborate with people who are doing the work. Therefore, we created the Advanced Inclusive Research Site Alliance. Our Advancing Inclusive Research initiative was created to broaden the inclusion of historically underrepresented groups in clinical research and ensure that personalized healthcare tools are designed for all patients. Advancing Inclusive Research is an enterprise-wide initiative that started 3 years ago to bring diversity to our clinical trials. We want to ensure that all of our patients in our trials mirror the patients who have the disease we are studying. We established the Advanced Inclusive Research Site Alliance with our 4 founding members: City of Hope, Mays Cancer Center in San Antonio, O'Neill Cancer Center in University of Alabama at Birmingham, and then West Cancer Center in Memphis, Tennessee. And these 4 founding sites to take a practical and focused approach to expanding diversity in real-world clinical trials. These research centers were selected based on their expertise and prior success in reaching urban and rural populations and patients of color, and desire to make swift progress in the clinical trial diversity and health equity. So we created a partnership model that, 1, meets patients where they are, develops an ecosystem based on trust and committed leaders, builds and enhances operations performance, while also advancing scientific understanding. And in doing so, we are creating long-term partnerships with people who are doing the work and have shown that they are And in doing so, we're one, building trust, but then also building communities where we can definitely put our foot in and be like, we've been there, we know where you are, how can we improve this? So what has come out of the Advanced Inclusive Research Site Alliance? So one of the co-creations that we've created with our sites is this idea of health literacy. So most people don't even know what clinical research studies are. And the first time that they might hear it would be in front of their oncologist who has told them, oh, you have cancer. Would you like to take part in a clinical research study? But they might have a lot of questions. So we have patient education videos. One is, what is a clinical research study? This goes over what is a double blind? Why would you take part in a clinical research study? And it goes over everything that a patient would need to know about being part of a clinical research study. Is a clinical research study right for me? Goes over why diversity is needed in a clinical research study, why a patient can see themselves in a clinical research study, and why it is important for them to enroll. And this one actually is one of my most proud videos that we've created. It's fully in Spanish in collaboration with Mays Cancer Center in San Antonio. And this goes over why Hispanic and Latinx representation is important in clinical research studies. And then it goes over with HCPs and patients the experiences that they might have had in clinical research studies. We also have HCP videos as well that goes over why it's important to have diversity in clinical research studies. So it focuses on implicit bias, racism, and all of the other things that might impact why they might not be enrolling patients, diverse patients in their clinical research studies. So all of these videos are available on our YouTube, but if you would like it with no logo, because we found out that some institutions don't really want to put a pharma logo on videos that they might share with patients, you can reach out to me and I can definitely give you these videos for your resource with the communities that you serve. Secondly, we've created an HCP training that is called the Advanced Inclusive Research Education Program that strengthens cultural competency, shares approaches to deepen trust in our communities, and supports representation in clinical trials. So this training is an HCP training that goes over implicit bias, on why underrepresentation in clinical trials is important, and then also focuses on historical mistrust, like the Tuskegee syphilis experiment. We go into depth, we ask them questions, we go over scenario-based situations where they can learn more about how they can properly recruit diverse patients. And then the last initiative that I would love to focus on is our Health Equity Symposia. So within Genentech's Chief Diversity Office, we sponsor community-based events that focus on healthcare disparities that address local issues and potential solutions to advance health equity. So we sponsor these initiatives where the community-based event chooses what they want to focus on. So let's say the Cleveland Clinic, these are all examples for LGBTQ health, but we've had them when it comes to Black women pregnancy. We've had one when it comes to Black men and prostate cancer at UAB. So these are sponsored events where they get to tell us what their community needs, and then we fund their webinars, events, anything like that. So the impact of this is, for one, the Cleveland Clinic, the team received additional funding to expand the program offerings to screenings, follow-up care, and diagnostic imaging throughout Northeast Ohio. For the Washington Health Alliance, the impact created a safe and open environment for individuals to get involved in more local activities to support LGBTQ health in the community. So this is a very amazing program that we have within our Chief Diversity Office that definitely focuses on, one, meeting patients where they are, and then also tackling local issues coming from what the local people who are part of that community would like to see. So I would like to close with what you can do. Embed social drivers of health focus initiatives in your clinical research studies. And secondly, show up differently by reaching patients where they are. And when I'm saying that, I'm talking about in sustainable, continued, and also proven ways. And talk to them about what they want, and don't assume that you know exactly what might be the best for them. Thank you so much for listening to my presentation. I'm not sure if we have a Q&A, but if we do, I would be more than happy to answer any of your questions.